Welcome to this discussion on fatty liver and its complications. To begin with, we would like to ask Dr. Jolly, what is fatty liver and how is it diagnosed?
Fatty liver means fat that is accumulating inside the liver cells. It is like a small droplets, fat cells is deposited inside the hepatocytes and the other fat liver cells. And how can it diagnose? Means if it's a part of the metabolic syndrome or the newer name X syndrome X. So that is obesity, hypertension, diabetes, that is and dyslipidemia. The dyslipidemia means increased triglyceride or cholesterol inside the blood. So there is excess fat inside the blood circulation and also inside in the body. That is why obesity. So in such patients, definitely there is a chance for fatty liver. So if a patient who is having any of this, obesity, hypertension, diabetes, dyslipidemia, or excess cholesterol or triglyceride, they'll be having fatty liver also. And next, you can find out whether really the excess fat in the blood. We check the blood itself. This lipid profile we check, and to know exactly whether there is excess fat in the liver, you can do an ultrasound scan and see there is fatty liver stage grade 1, grade 2, and grade 3. And also now there is fibrosis scan, because if fatty liver next stage is the hepatitis actually. When the hepatitis comes, that liver cells are damaged and it is converted into fibrous tissue. So that is called fibrosis, and it is when it is in the extreme, it is when it is progressed, it is called a cirrhosis. And the liver will be shrunk. And initial stage, the fat accumulation, the liver will be really enlarged actually because of the fat deposit. When it comes to the fibrosis and the cirrhosis, it will be strengthened, the liver cells will be reducing, and which will be converted into fibrous tissue, just like any other scar. And when you form a scar formation is coming, there will be fibrosis. That is the thing basically.
Say, can you have fatty liver even though you are not overweight or not obese?
Yes, there is patients who is not overweight or obese or even below normal weight also can fatty liver. That is because of this other toxic elements in their the food, or in the other way, or because of the sickness itself, or even there is a continuous viral infection like hepatitis B infection, C infection. In such cases also the liver management is not proper. In that case it can come. There are people who is having many, what I have seen is with the normal weight or patients with fatty liver, insulin level will be very high. They may not be diabetic, but their insulin level will be high. That means there is a metabolic error and hyperinsulinemia. Hyperinsulinemia, one of the cause for the fatty liver, because insulin resistance shows that when there is insulin resistance, the metabolism of the fat is very abnormal. And also those patients with hypothyroidism, thyroid problems it can. And also there are patients with certain deficiencies, vitamin D deficiency or some other, so many. If there is a deficiency, there will not be one deficiency. There can be multiple deficiencies can be there. In such cases also, there is difficulties like a fatty liver can occur.
Often it is felt that fatty liver runs in the family. That is, the parents may be having it. So when they check up, they think that most probably their parent was also suffering from this, because they don't see any reason why this fatty liver is there, because generally public feel that fatty liver is something to do with alcoholism. And when the person is not an alcoholic, then they think it is something like hereditary, I have got it. But it is understood that other than being just hereditary, there can be so many other reasons why this fatty liver can develop without any alcoholic background. So, what are the other factors that can contribute to fatty liver?
Basically, alcohol is a carbohydrate. It's a food actually. Only thing it has some any food. Food also has some problems it can create. Just like alcohol is a energy giving food actually. Only thing when it is excess it is taken, it will damage the liver. Not only liver, it is major damage is happening in the brain. Actually, it is suppressing the brain action, and also it is this addiction formation is bringing. So just like that, alcohol, what we eat is this cereals and all these sugars. Everything is actually another carbohydrate form. So it is the liver has to transform this carbohydrate. If you are taking excess, either in the form of wheat, rice, or sugar, or fructose syrup, like all the pastries and whatever things we are eating. So all these things is carbohydrate, and the impact on the liver will be more if it is fructose also. That is so latest studies shows that now the sugar form we are using fructose syrup actually. So the high content. So this fructose liver, it is very difficult to convert. It's actually it's a stress for the liver to convert the fructose into glucose, and so basically it is accumulating in the liver, and also for excess fructose there is a tendency for insulin hyperinsulinemia, that is development of the insulin resistance is high. That is actually insulin resistance is the primary cause for the type 2 diabetes. So that is there. And also when you eat excess carbohydrate like glucose, fructose syrup, rice, wheat, everything, if it is excess, it has to be converted into fat. And then the liver is making the fat, and then it has to be transported into the fat cells for storage. Because of this insulin resistance, when the fat become excess, there will be insulin resistance and hyperinsulinemia will come. And the mobility of the fat, this excess, the liver may be able to make some fat, but it cannot be transported into the other cells, and the other cells means the fat cells, and deposits them. So it will be accumulated in the liver cells itself. That is one of the reason. And why this hereditary nature? See, with the parents are giving the child the genetics, all these lifestyle diseases. Fatty liver is a lifestyle disease, and the lifestyle disease, any lifestyle disease has two factors. One is hereditary, and the lifestyle itself. The parents is giving the genetics, and also the lifestyle. The child is living with the parents in the anyway till they are moving out for the university or for the job. They'll be living with them. So the basic food habits and the exercise habit, everything is getting from the parents. All this starts with the food itself, and the food and exercise. And when there is excess calorie in the diet and sedentary lifestyle, and that is running in the family, definitely both is going together actually. So if the parents is having, if the child is, if the parents itself is very conscious and making the child advise the child to correct the lifestyle, that is not possible if you are leading a lazy or the sedentary life and asking the child to do it is not possible. And you are eating all the junk food and stocking all the junk food at home, and the child to become healthy. It is not possible. So actually, if you want your child is to be healthy, if you have any obesity, hypertension, or any of the lifestyle diseases, this can be reversed. Not with medicine. That will always be. Remember, you cannot reverse any of this lifestyle diseases, diabetes, hypertension, everything, and you go and check up with the doctor, and the doctor will give all the medicine. No, it is not possible. You can reverse it with the changing your lifestyle. So if you are particularly, if you are planning for a baby, you should definitely, both parents should correct their lifestyle and then correct their body composition if you are obese. Otherwise, itself, it is very difficult to live, even for a healthy person. Then ill health, a person with ill health, it will be very difficult. So now the latest studies also shows that there is, if a person is diabetic or obese, the chance of getting the child such diseases, or even the obese person, the child when they get older, the chance of heart disease is higher. So why should we make prone our child for such diseases? So correct the lifestyle, make you get yourself healthy, and then try for the pregnancy or having baby. Otherwise, will be a problem for the child, and they will be, you are inheriting, and you correct yourself, and then only you will be able to guide your child for a healthy lifestyle.
Actually, this fatty liver often it is not diagnosed. It goes undiagnosed, and at a more difficult stage only people realize it. So, in your opinion, what is generally to be understood so that in case a person is having fatty liver, it can be found out early so that the necessary steps can be taken?
Yes, definitely. We should, if a person is fit and no sickness, then even though we'll always, once in a year, we have a checkup and all. So if you have any problems, like you should always, it's easy to find out fatty liver in a visual assessment by yourself. You can see your body composition in a mirror and see your shape. If you have a protruding tummy, definitely you'll be have a fatty liver chance will be very high. And when you do a blood test, if you have a triglyceride level is high, then you will be a chance for having a diabetes will be high. Usually, no one check for this hyperinsulinemia at all. If you check HbA1c, for me, I'm usually, before I start treatment for the clinically, I'm basically giving clinically supported lifestyle correction for lifestyle diseases. Before starting the treatment, we assess almost all the body parameters, like even hyperinsulinemia, all this insulin resistance, we assess the insulin resistance and all. So from that, I'm talking from my experience actually. It is you may not be able to find it if you are in the medical literature or in the Wikipedia. If you check internet and all, you may not find what I am talking directly in that. This is many of these aspects are there are studies I am quoting that definitely it is there. But many other aspects I am talking from my own experience of giving clinically supported lifestyle correction. And what I find is that even before that starting, all these blood parameters we check, liver parameters we check. And there are people, you will be having fatty liver only. Fatty liver we can assess with the ultrasound scan. And other things from the blood itself. A fatty liver or this fibrosis and the stage of fibrosis, or we can. And luckily, I'm practicing in India, in our part. All the tests are very economically. I am getting patients from US and UK and other countries, there it is very difficult for them to do any of this test. Only this insurance oriented and insurance if their physician asks about it, and there is limitation for such test. But in India, in Kerala, it is very reasonably, very compared to the other countries, very economical, and we can have a full detailed study. And also, we'll be assessing it in the every week itself in the initial stage. And in my experience, if the fatty liver scanning, we repeat only after 3 months usually for this fatty liver and all. And the other blood test, that most of the liver patients, their liver enzymes will be high, SGOT, SGPT, and all will be high. So that will actually, from the 8th day itself, it will start coming down. And this triglyceride and cholesterol and all will start in the 8th day. We repeat the blood test, and if this lipid profile and liver function test, we repeat in the 8th day itself. It starts coming down in the 8th day itself. And in the 15th day, it will be further down. It's depending on, most probably by 15th day, it is normal, or by the for 1 year, most patients, it will be come down to normal, this liver function test. But within a 1 month, fatty liver won't come that fast. It will take some more time, usually. So we check it on the third month, actually, 90th day. You check the liver, this ultrasound scan also. If the fatty liver is a grade 2, it will be come down to, usually within 3 months, it will come down to at least to grade 1. And if the grade 1 person will be usually come down to normal fat liver. I can tell you an example. Actually, one patient recently come for the review. This person actually he has diabetic and hypertensive, and also the fibrosis, liver fibrosis stage 4. He didn't have any symptoms. Only thing, he was diabetic and hypertensive, and regular checkup. Yes, the fibrosis was found. Then they had asked for a fibroscan also, and it was stage 4 fibrosis and cirrhosis. Actually, this person, the liver was shrunken also. And the third month, by the third month, it's actually this person, the liver enzymes also was very high. And within 1 month, liver enzymes and everything, diabetic, hypertension, everything is cleared. Usually, when we start this diabetic patient, if it is type 2 diabetes, that is, if the insulin level is normal, we stop all the diabetic medicine in the first day itself. And we monitor. We are stopping and not forgetting about it. And every day, 4 times, we had to check at home and give a report also. And within 24 hours, the blood sugar will be corrected. And if most of these patients will be having hyperinsulinemia, we check the insulin level in the 8th day itself. The 8th day itself, the insulin level will be would have come down. And usually, what we are actually expecting is within by 15th day or usually 30th day or so, the insulin level usually we are considering it's around maximum is 25 around. And if many of the patient diabetic or many non-diabetic patients, it can be, I had seen insulin level 300, 200, 300, different levels, very high. And this will come down very fast if with the correct exercise and correct nutritional support. This insulin level also comes down. Not only the sugar or not only the SbA1c level comes down, even the insulin level will be come down, and it will be actually you need only 3 or 4 or 5 units of insulin when you check into the blood. That is, instead of that, for 4 or 5 units, it is 200, 300, and all for many patients. That is because of the medication also. Many of these medicines we are using for the diabetes is actually making the pancreas work more and produce more insulin. to overcome the insulin resistance, you are producing or pushing the pancreas or pushing your body to make more insulin. Actually, instead of that, you correct your lifestyle and give the correct nutrition. This insulin resistance, insulin is not working because of the some deficiencies of the other vitamins or minerals like chromium, vitamin D, B complex. All this, if the hormone has to work properly or your metabolism has to function properly, you need many other nutrients also. So instead of giving the correct nutrition and correcting the nutritional balance and giving the body essential activities, physical activity, you are making the pancreas to work more by adding medicines. That is actually again creating trouble for the liver, because whatever you eat, it is going to the liver first, and liver has to metabolize or remove it. Only the bit which is not liver, poor liver is not able to metabolize, it is reaching the blood circulation and trying to give you a medicinal effect actually. So whatever medicine you are taking is giving trouble for the liver, and a person who is having liver disease like fatty liver or liver fibrosis or whatever, the first thing you have to do is to come out of medication. And it is very easy, for in my experience, within 30 days most of the medications can be reversed, and the diabetic patient and all, within the 8th day itself, we are not only every day we are checking at home the sugar level, but the 8th day itself we are checking the HbA1c also. And HbA1c will come down without medicine itself. That is also we are checking, and that is to see that whether the patient is following it properly. If the patient is following this properly, it is very it can be even the hypertension medicine, everything can be reduced within a month. Only thing, if a patient has put a stent, then they had to take this blood thinners for another 1 year. Or if someone has put a pacemaker or an artificial valve, such patients, they had to use the blood thinners. We don't stop the blood thinners initially. This pacemaker and permanent fixed stents, we had to continue it lifelong. But if the stent is put, then after 1 year, you can stop that also. We are before stopping that, we are making sure that your cholesterol and all the blood parameters, the HSCRP, all these cardiac markers also normal. And if the all the parameters are normal, then we can. Everything is, this is clinically supported lifestyle correction. It should be evidence based. That is the modern medicine. The standard is evidence based, and reduce according to the blood report. All symptomatic medicines like painkillers or the steroids for this immunosuppression and all, we can reduce according to the symptom wise. The other things according to the blood report wise, and fortunately in India the tests are very economical and we have the freedom to do it, and so we can definitely check it and correct it, and that is the advantage actually.
Actually, when we talk about this fatty liver, it is said that this fatty liver has a very big connection with the kidney health, and fatty liver is one of the promoters of chronic kidney disease and its complications. What is the relationship between fatty liver and kidney health? And if a person is diagnosed with fatty liver, what else should that person be concerned about kidney health?
If you have a grade 1 fatty liver, it may not be having much impact on the kidney, but it is all progressive. So we should understand that liver and kidney is working together. Both are excretory, helping for the waste removal. The liver is actually metabolizing the things. Even if you take a medicine also, it is metabolized by the liver. And whatever you are eating also, the protein, carbohydrate, fat, everything, it is actually digested and absorbed into the liver actually. It is actually, there is a portal circulation from the intestine. Whatever the intestine blood veins are coming and collected, joining the portal circulation and opening it into the liver actually. Liver has a two circulation. That is also everyone should know that when you are thinking of the liver health. Liver also, just like any other, our hand or leg, they're getting artery circulation and vein is there. But additionally, the whole intestinal drainage is coming into the, it's a portal circulation, portal way, and it is opening into the liver. And that liver contain this, that blood contains all the nutrients absorbed from the intestine and also all the medicines which is absorbed from the food, medicine, and also the preservatives and all the additives, and which is anything other than the nutrient is a strain for the liver, and liver has to make it detoxified. If the liver is not able to detoxify, it goes into the general circulation, and it is the next is the kidney is the responsible person. Kidney is basically, its function is to, this metabolized things can be removed, but many of the unmetabolized thing by the liver, it is detoxified, basically not metabolized, it is detoxified, these medicines and all. Detoxification, without detoxification, kidney cannot remove it. So if too much of too much of toxins which is not detoxified with the liver, it gives an impact on the kidney, and the kidney function also will go down. And next is in the system, this liver, kidney, and next is the skin. If the liver and kidney is not able to remove a toxin, then it will come to the skin. Please remove me through the sweat. That is the next to know. So if when it comes to the skin, and skin is actually having limited excretory functions only. So that is the reason for many of the liver patients and the kidney patients having black patches, especially in the face, or even in the face, and also any part of the body, and even the leg. And they can get the darkening of the leg can be seen, and also the forehead, cheek, etc. So that is actually, there is a reflection. If you have a discoloration in your face or a patch on the skin, it is you should definitely look into the health of your liver and also the kidney. Liver function and kidney function, and also an abdominal scan that will give a lot of information. Abdominal ultrasound scan. You don't have to do a CT scan or MRI, because that will all add some radiation into your body. But you can do an ultrasound scan. It is safe. That is even used for the pregnant lady. So safe for the baby also. So it will give an idea about the liver, kidney, your genital organs, intestine, and even pancreas, spleen. So many organs you are getting an idea with a very minimal cost. So it's very cost effective doing an everyone should have an ultrasound scan for the abdomen, and general blood blood test, and the liver function test, kidney function test, and all. So that even if you are becoming older, you should do tumor markers also. That is to see whether there is a possibility of cancer, and also these inflammatory markers, CRP, HSCRP, and all. So you can get an idea about this and correct it. So you can even you can prevent even the cancers, even the liver cancer. There is markers like this AFP, alpha fetoprotein, that is one of the marker. And even there are even the colon cancer, there is CEA, ovarian cancer, CA125, and even for the lungs, if you're a smoker, you can check into the CIFRA, and so many tumor markers are there. You don't have to, for lifestyle correction, you don't have to prove biopsy proof, nothing is needed. If the tumor marker is the, I think, is the early sign of the cancer. But you cannot go for, if you find out a tumor marker, PSA is high, you're not going for immediately chemotherapy or the removing the organ or radiation. That is not ideally, that is not the treatment. Actually, you should, you find out early finding out and correct it, not by medicine, by the lifestyle. This all this even the cancers. The basic reason is the lifestyle. And if you are able to diagnose the early stage of the fatty liver, early stage in the kidney problem, or early stage of cancer through the slight increase in the tumor markers itself, you can reverse. And I'm doing it. It's because from my experience, I'm telling. I'm seeing persons with the PSA high, CA125 high, CA high, and even CIFRA, that is the lung marker. And if we are willing to correct your lifestyle, you can see it is coming down within not for too long. Too much time is not needed. We are checking it in the weekly itself. Usually within a month, you can bring it down. And if you're not, it is not coming down, you should go for a stricter dietary changes in the point of view carbohydrate restriction is needed actually. So it is very simple and easy actually to reverse these diseases, provided you are willing, and you should get a correct direction also how to make these lifestyle changes.
Actually, nowadays, what is happening is the quantum of prescription drugs, medications, and all that are being taken have increased very much during the last 20 odd years. So, in such a situation, virtually all those who are taking these sort of multiple medications have, it seems, fatty liver issues. So how do you understand what is the way out when we say that medications and drugs and all can affect fatty liver in a negative way? What is the solution when they have to take multiple drugs for their different ailments?
See, generally for the last 50 years, number of medicines are increasing and the people are eating more and more medicines. We were having great hope in modern pharmaceutical and surgical interventions, so many new surgical modalities. Even here, I think in my start of my medical practice, actually, this ultrasound scan and even the CT scan, actually, all in India, actually, we are starting to get it in the 80s. Actually, I started my medical education in the 1981. So during that was actually so much of changes was coming, so much of medicines were coming after that. Even the investigations, so much of change. So it is definitely great. This, especially the scanning and this many tests, even this antibiotics, so many medicines was actually uh, given so much insight into the medical field or our own health itself. The investigations improvement is very good, but the medicines in the lifestyle, even the antibiotics, it is given lot of we are able to antibiotics, antivirals, and all is able to prevent lot of death, and also the improvements in the surgical procedures, accident care, traumatic care, everything is very wonderful. But for the lifestyle diseases, we are depending so much on the medication. Diabetes, hypertension, cholesterol, everything we are depending on the medication, but it is not much of use because the base is not the lack of medicine. Is the lack of problem is with the lifestyle. Then how can you correct it with medication? So first preference you had to give. So if you have a high BP or any such problems, you can immediate relief, or high blood sugar, you can immediate relief. You can take medicine, but you have the long term. You should think of the lifestyle correction. For the fatty liver, there is no medication. In the cirrhosis, there is no medication available. Diabetes, hypertension, and all this, there are so many medications are there. But that is only for that. If your action time is only 8 hours, that 8 hours after that it will shoot up, whatever be. Only for short time that is action. Even the cholesterol medicine. Actually, cholesterol medicine, liver is actually making the cholesterol. Cholesterol is increasing because you have a metabolic block somewhere. You may be having a vitamin D deficiency, or you may be having a your this sex hormones level may be low, or some other reasons will be there for this cholesterol, because cholesterol is needed for so many activities of the body. But you are actually giving medication, statins giving, and blocking the uh, cholesterol formation itself. So that is actually increasing the strain of the liver again. Not only detoxify the statins, it is actually the one of the function is blocked. So your new cells coming, formation of the new cells, which is damaged cells to be replaced with the new cells, for that cholesterol is needed. Even for the functioning of the brain, you need the cholesterol. And if you're blocking the cholesterol and making it less than 150 and all, it will be affecting your repair of your body also. So, but and if you are stopping the medication for 1 week, and after you check after 1 week you stop the cholesterol medicine, statin, and check it, it will shoot up also. So it's only for the time being, any medicine. So that we should understand that. So for the lifestyle disease, you had to depend on lifestyle correction, and you had to find out a way how to correct it according to your body composition, your body parameters, and of course your likes and dislikes of the food, and also has to be considered, because someone will be vegetarian, vegan, veg. So many preferences also will be there, and also there will be so many restrictions according to religious interest also. So we are actually, I'm with this clinically supported lifestyle correction, we are actually giving all these parameters also is considered, and the special food which is ensuring all the nutrients, and also the body also. There are around 650 muscles are there. So actually only thing which is we can make your body function according to our will is the skeletal muscles, that is the muscles which is attached to the bones. So you had to have an exercise pattern also, and correcting or stimulating all the muscles of the body, so that it will indirectly stimulate all the organs, other organs, including the brain, liver, and everything.
When we are talking about fatty liver, what happens is that generally when the person is diagnosed for fatty liver, uh, the general feeling is that there is nothing that has to be done with respect to medical care. He should look after his health, he should take exercise, he should reduce his weight. These are the general opinions that happen. But we see that after a few years, this person's fatty liver situation becomes more serious. Now, what is it that is causing so many people who are diagnosed with fatty liver even early in their lives to suffer serious fatty liver problems later in life? What is it that is going wrong with this general approach to this?
See, usually people won't take it serious because everyone is having fatty liver. So why should I bother about it? Even the doctors will say, you take some changes in your diet and exercise. And don't worry over, because it is the doctor's responsibility to make them comfortable. So don't worry, you do that, and it is everyone is most of us is having. Even the doctor will also having fatty liver grade 1 or 2, because most of the doctors, especially in India, I think at least, are obese or overweight, and definitely because doctors basically exercise less because of their professional this thing. Also, it is because of the working condition. There is a lack of exercise there in the medical profession, not only doctors, other medical professionals also. So, personally speaking, most of them will be always already diabetic, hypertensive, and this uh, fatty liver definitely along with that will be there. So, even a doctor who is already taking all these medicines or already have this lifestyle disease is there, they're they are not able to motivate themselves to correct it. And how can they motivate the patient to correct it? That is a question is coming. And if a person definitely that is the situation. Even our own medical studies conducted by the medical associations itself shows that the life expectancy of the doctors is much less than, I mean, the average Indian is around average Malayali, it is around 72, and the average Malayali doctor is only 63 or less than that. And it is conducted in another state in India also. It is in Pune or Maharashtra or somewhere. They also saying the same thing. The average human lifespan, the doctor's lifespan is less than more than 10 years less actually. So that is the situation here. That is a study conducted among the modern medicine in India. In our country, there is so many other specialties like Ayurveda, Homeo, and Unani, and all is that. This I'm talking about the studies conducted in India among the modern medicine doctors. So their lifespan is less. So that is also the lifespan is decreasing because of the lifestyle diseases only. So that is the situation. So we should understand there's no medication for fatty liver, cirrhosis, or kidney disease, kidney failure. Only you can, even the kidney, if it is fails, you can do at least, you can rent a dialysis machine, that is an artificial kidney, for 1 or 2 hours a weekly, once or twice or thrice a day. So you can extend your life somewhat, or go for a transplant. In the case of the liver, also the same thing. If the fatty liver increases, then it is goes to fibrosis, then cirrhosis, then or the cancer, or a complete liver failure. Then what is the option? This next is only supportive measures, like if you have a ascites or the protein, this thing is getting low, you can give some albumin trip or something like that. Or if you are bleeding, uh, very varicose seal of the uh, esophagus, you are bleeding, give some like this sclerotherapy or block that bleeding. That is only the treatment which can provide in the modern medicine. Uh, the problem, what we can do, what is the possible. There is no medicine, so what is the possibility other than the medicines? Correct the lifestyle. First thing, your patient should understand that they should come out of diabetes, out of hypertension. This diabetes and hypertension and heart disease medications and all can be reversible. And I'm telling it from my experience. You may not see it if you are looking into the medical literature or medical book. They won't say it. It's modern medicine books won't say it. It can be reversible because it is not reversible with medicine, but you can reverse it with the lifestyle modulation. That is my experience. And you, as I said earlier, you can make almost within a month you can come out of almost all the medicines. The patients who is liver failure or kidney failure and or those who are advised to for angiogram or bypass, after angiogram bypass, all these patients, they may be taking 20 or 30 medicines. Even this liver failure patients taking 4 or 5 medication for the diabetes and along with that insulin and 4 or 5 medicine for the uh, hypertension. Of course, statin will be there. Maybe some more medicines like this cholesterol lowering agents may be there. And usually there will be something for the uric acid, and if it is men, there will be something for the prostate, like this urinary problem also. That is what is a common situation here. And they are all, if the person is willing, they can come out of all these medicines within a month. And without the medicines, this diabetes, maybe they may be having a HbA1c level for 10 or 11 with all these medicine, but it can be come down to no less than 5.5. That is our aim. At least less than 6. That is we are expecting. Within 3 to 6 months, we will be, if the patient is following the things correctly, the patient will be able to come down, bring down the HbA1c level, which is not controlled with all these medicines, can be controlled by without medicines to 5.5 level. And most of the hypertension medicines also can be reduced and stopped within a month. Only thing, if it is not possible, it is only if the patient is not able to bring down their obesity. If a patient is following correctly, they'll be able to, if they are obese, they'll be able to bring down the body weight 20% actually. If it is 100, within 2 3 months, it is 80 kg. That itself, with its home management, if we are able to give a controlled atmosphere, I'm not giving a controlled atmosphere, I'm not giving and allowing them to stay with the family itself. If it's a better controlled environment, I think it can be even more, 25% reduction within 3 months itself. So that is according to how much your excess fat in the body. Actually, in this, we are building up the muscle and bone, and only try to reducing the fat level reducing. And so if the fat is gone, the fatty liver will be gone. That is the basic principle. If the total body fat is reducing, the fatty liver will be gone. And the liver has the positive thing is it can regenerate. That is a wonderful. The liver is really a wonderful organ, and it can regenerate. So actually, I remember one patient. Actually, he was in the first stage for fibrosis, and it was shrunken. And in the 30th day, the 90th day, 3 months, it rechecked, and he came for the actually last this week itself. He came for the 180 days review. And by the 180 days, his liver has regrown to normal size, and the fatty fibrosis level was level 4, and it was shifted to 2 to 3. This is written as fibrosis 2 to 3. So it is level 4. That is the extreme limit. So that is the situation. That's fibrosis you can reverse, and the shrunken liver can regrow also. So that we should understand. And that is not with the medicine, only with the nutrition. And exercises which can be, it's not a gym or you don't have to lift weight or anything like that. Just lying down exercises on the bed itself. You don't have to go to the floor or mat or anything. You can do it in the bed itself. Even the sick persons can do it. Sitting and lying down position, you can do the exercise and you can achieve. If you are obese, you can achieve a 20% weight reduction. And if you are not obese, you don't have to. Only thing you are come down to what you are expecting is to in India BMI is expected to be ideal will be 18 to 23. So if you are if you are more sick and less active, or you are not doing much physical activity, bring down your BMI to 19 or even 18.5, bring down to that. And by the time your fat level will be reduced, even the body age will be reduced. Many of the patients who are coming will be 10 or 15 or 30 years accelerated aging, the body will be showing. And even this accelerated aging persons will come down to, even if a 50-year-old person, it can bring down to 40 years actually. The aging also can be reversed. That is actually the most positive and the thing which is giving professional satisfaction also, because you can achieve it. Those who cannot achieve it with medicine can be achieved with simple measures.
Actually, when we are talking about this fatty liver, it is generally believed that fatty liver is affected very much by stress and the release of certain steroids and all that. So, how can a person with fatty liver or what should he understand about stress management?
See, fatty liver person will be having not only fatty liver, so they'll be having some other problems also. So definitely stress is a aggravating factor. There will be hormonal changes. Even the stress is actually making your insulin resistance, because the steroids are coming. When the stress is coming, steroids will be there. Secreted, and also this adrenaline, noradrenaline, so many hormones are coming, and so the insulin resistance is coming. So it will all add to the fatty liver and the liver problems also. And the person will be all this. What I am saying, I have not. I never seen a person who's coming for me. I had doctor. I have fatty liver grade 1. I want to correct it. No, the people will be so much ignorant about this thing. And if they have it, usually the person will be having the obesity will be there, or even when we check into the details into it's not only fatty liver, there will be NASH, non-alcoholic steatohepatitis, or the alcoholism also, it will be combined. Anyway, I'm taking alcohol also, but if it is, you cannot control alcoholism also, it will be very difficult to manage actually. So there will be associated heart disease will be there. They may be coming, they'll be having fatty liver, they know it for a long time. But now the problem is had a chest pain and look for a angiogram. There is problem. No, angioplasty cannot be done, or one stent is put, but they made a repeat angiogram and put more stent, or they cannot put more stent, so they need a bypass surgery. such patients are coming, or the patient who's with stage 3 or 4 liver fibrosis, and who is on medication for diabetes and hypertension for the last 20 or 30 years. Or there may be, all these patients will be, when we check into the renal function, there will be renal failure grade 3 or grade 4, even grade 5. So that will be the sort of patients we are getting actually. And definitely, if the patient is willing for the correction, and definitely they will get the result also. If they are not willing, what we are assessing is if they are taking the nutritional support and all correctly, and whether they are able to reduce the fat. That is so actually what in this we are doing is correcting the body composition in the macro level and at the micro level, at the cellular level. So if you are able to do that correction, the body has this tremendous capacity to rebuild it. Actually, your body now, what second is another second, your body is actually changing. The many cells are destroyed and many new cells are coming. And the new cells which is coming, your maybe lakhs of cells is born every second actually. And if the nutrition is in the correct level, the new cells which is developing will be becoming healthy. So they will replace these damaged cells. That is actually happening in this when we are correcting or modulating the lifestyle with the correct nutrition and correct exercise. You are actually giving an opportunity for your body to rebuild your body. And there is a science behind that also. Your this immune cells, white blood cells, WBCs and all, will be replaced almost within 4 to 7 days. And your internal covering cells, mucosal cells, intestinal cells, it also replaced in a week actually. Even the respiratory covering, this all the tract covering cells and all. So the even liver cells actually, it is actually taking the complete replacement of the liver cells takes almost a year. So if a liver problem is there, you may need up to 1 year or 1.5 years of correct. You should ensure that correct nutrition and correct exercise is there. Then you can even rebuild your liver, and not only the liver. Simultaneously, all other organs also will be rebuilt actually, or repaired.
With this, we come to the end of today's discussion. Thank you.